Good day, everyone. We are Group 4A of BSN 3A, and I, Althea Padecio, together with my groupmates Florianne Jamie Oraa, Orville Joseph Paez, Pia Pakingking, and Ysabelle Perida, will be presenting our research entitled Attitudes Toward the COVID-19 Vaccination Among Nursing Students. The researchers, as student nurses, were given the relevant facts about the attitude concerning decision making in having the vaccination and intend to validate this phenomenon among student nurses in the university. The results of this study may assist the college administration and local government unit by identifying the causes of student nurses' hesitation and unwillingness toward the COVID-19 vaccination. Hopefully, this study may contribute to future researchers interested in doing a similar study by using this as related literature.
This study used a quantitative descriptive research designed to see if there was a relationship between nursing students' vaccination attitudes and the COVID-19 pandemic. A total of 210 nursing students in levels 3 and 4 out of 447 were involved in the study. Taro-Yamana's formula was utilized to determine and compute the sample size. The researchers utilized stratified random sampling, wherein the researchers collected the data and divided the population into numerous subgroups chosen randomly using the lottery method. Wheel of Names was used to generate random names to determine the participants.
For the research instrument, the researchers modified a standardized questionnaire adopted from Abebe et al. That includes 25 descriptive survey questions. It was divided into two parts: the demographic profile of level 3 and 4 nursing students, and questions on self-assessment of nursing students with their attitude toward COVID-19 vaccination. The researchers used a 5-point Likert scale assessment tool from strongly agree to strongly disagree. The Gunden's validity test was used to assess and score validity of questionnaire, which resulted into 4.9, which is considered to be excellent. The study's reliability was determined using Cronbach's alpha test, which resulted in a score of 0.89, which is a good internal consistency.
The following pie chart shows 210 participants in the study. The demographic profile reveals that most of the participants were female students with nearly 75% compared to male students with 25%. More than half of these participants were 21 years old, while the least participants ranged from 23 years old and above. The third-year level had the greatest number of students among the participants, with the highest number coming from Section D, having 40 students. The majority were Roman Catholic, while a total of 209 students are fully vaccinated, with only one participant being partially vaccinated.
For SOP number 2, participants showed a positive attitude toward COVID-19 vaccination in terms of perceived benefits and cues to action. It conveys that the implementation of vaccination programs and information dissemination among the students played a significant role in their decision-making toward COVID-19 vaccination. These findings indicated that the majority of students use social media for health education to educate the community about COVID-19, highlighting the significance of using electronic information resources to save time and effort in information exchange. However, the participants have a neutral attitude toward COVID-19 vaccination in terms of perceived susceptibility and severity.
There was a positively high association between the attitudes of the participants toward COVID-19 vaccination and their vaccination status. It depicts that the aforementioned variable influenced the participants in making decisions and adhering to vaccination programs. There was a significant difference when grouped by age in terms of perceived severity and when grouped by section in terms of use to action. This means that nursing students with a high COVID-19 risk perception may increase their knowledge, awareness, and understanding of the vaccine, resulting in better acceptability.
The insights that were drawn from the experiences of the participants were the following. Nursing students are well aware of the efficacy of COVID-19 vaccination in terms of their perceived benefits and cues to action, which means that the majority believe that the vaccine's benefits outweigh the risks. Implementation and information dissemination also played a vital role on how each nursing student decides whether to get the COVID-19 vaccine or not. However, the participants have a neutral attitude toward the COVID-19 vaccinations in terms of perceived susceptibility and perceived severity.
The researchers would also recommend it to the following stakeholders. First is for the Department of Health officials to continuously implement effective strategies in vaccination programs and accurate information dissemination to prevent the spread of misinformation. For local government units officials to highly encourage the community and continuously improve vaccination planning, education campaigns, and vaccination delivery. For the College of Nursing, administrators to encourage other nursing students, particularly at different levels, by providing programs regarding vaccination drives. For nursing students as future healthcare professionals, in providing health teaching among their family, community, and co-student nurses, which can influence their attitude and adherence through accurate information. For the future researchers to utilize other variables by exploring different levels of nursing students, such as levels 1 and 2, to determine their attitude towards COVID-19 vaccination, despite not having it as part of their current requirements, and consider to include COVID booster shot as a variable of vaccination status to determine if nursing students likely receive booster protection against COVID-19 virus. The QR code and link to the references are shown below. That ends our presentation. Thank you.